Hi, this is Dr. Bob Dannenhoffer with another of our Facebook Live videos. So you can see I'm wearing a mask today, and that's something we'll certainly talk about, but we understand there's some people who lip read, so I'm going to take it down so they can lip read. I'm maintaining my social distance, so that's a good thing. So anyway, we have a lot to cover since the last time. In the world, we're seeing just a terrible, terrible increase in the number of cases around the world. Just terrible, well over 1 million cases. Lots of deaths, especially in New York, New Jersey, and Connecticut areas. So it's really just heartbreaking to see that. And we're also seeing big outbreaks in Florida, Louisiana, Detroit, and Chicago. Oregon's been pretty lucky so far. We still have new cases every day, but the number of cases is not exploding like it is in other areas. And the number of cases in Douglas County has been relatively low. We're up to 12 cases now from 10 last week. But we have 416 negative results, so we're really testing a lot of people, about 4 per 1,000, so that's a relatively high rate. We still have just 2 hospitalizations. They're doing, I guess, okay. No deaths. We have 1 person who's recovered, and when we checked today, there were a couple of people who were very close to recovery, so that's a really good thing. So you see I'm wearing a mask here, and confusing information about a mask. So if you check back in February, the Surgeon General said, oh, don't wear a mask. And then later on, people said, well, you might wear a mask. And then people said, oh, no need to wear a mask. And then last week, the CDC said, you might wear a mask. And then the president said, you could wear a mask, but I'm not going to. So it's all very, very confusing about a mask. I put together a little mythbusters kind of video yesterday that I did in my shop, and my daughter very nicely did some great videography. And I think that explains what the mask is all about. So let me quickly explain. So a mask can be there for 2 reasons. One is to protect you from getting germs, and that works okay in that way, but it only works okay if you don't touch the mask and you don't touch your face. And I can tell you, if you're not used to wearing a mask, and even if you are, it is just impossible not to touch it, to adjust it and move around. So wearing a mask to protect yourself may or may not work, but what it really does work is, if I'm sick and coughing, it tremendously stops the amount of stuff I put out. So we did yesterday a deal where we used spray paint as an approximation of the human breath, and showed that really a mask does an incredibly good job of blocking my spray, although it doesn't do as good a job of protecting me from illness. So check it out. It's the Mythbusters thing that's on the YouTube channel, and you can also find it on the website. You know, as I said earlier today, people of a certain age will remember a Seinfeld episode where they're watching a surgery and they lose a thin mitt into the patient. Doctors wear masks during surgery not to prevent them from getting sick from the patient, but to prevent their spray from going into the patient and infecting the wounds. So masks really do work on the sick person and really do work to prevent spread. So the recommendation is to wear a mask if you're out in public and can't be sure of your social distancing. So here we have it so that I'm well social distanced from everybody else in the room, so I would need to wear it. But let's say you needed to be in a taxi or something with somebody close. That would be a reasonable place to do it. You're out grocery shopping, waiting in line in the post office where everybody else may not be socially distanced. That'd be a great time to wear a mask. So I had my mask around my neck all weekend, and when I went into a store or went into a place, I put it up. It is a little bit uncomfortable, but you know what? If I'm now carrying this and am asymptomatic or coming down with it and going to be maybe do it, I would really like not to spread it. So that's why I have this mask around my neck. So, this is a good question. So why doesn't nebulizers work with the right drug in it? Maybe they don't know what drug yet. So the answer is they don't know what drug yet. If they knew, they would do it. Now, the Chinese have used nebulized interferon alpha, and unfortunately it doesn't seem to be working, but you're right. If you could nebulize this drug and get it into your lungs, it might work. So for example, we know when people with cystic fibrosis that have bacterial infections in their lungs that you can use nebulized antibiotics, and they work pretty well. So nebulizers may work because nebulizers get things in incredibly small particles that get well into your lungs, so it might. So when will antibody tests be available? None too soon, Jersey asks. So the story is I was just on the phone today trying to get the first antibody test here in Douglas County, and they're not taking our call. So I imagine everybody called today finding about the antibody test. The antibody test, though, should be available in the next few weeks. Those will be incredibly helpful to let us know if somebody's had the infection in the past. The antibodies don't turn positive in the first week or 10 days. And so it's not going to be a particularly great drug for acute infection, a test for acute infections, but it's going to be a really good test to see if those people who were sick in February had it, or those people who really thought we had it but had negative tests had it. So in other countries, like Singapore especially, where they've used the antibody test, it's been very, very helpful in that way. So great myth and mythbuster. Yeah, I thought it was great. So that was my messy shop. So when this is all over, I'm going to get a chance to clean it up. All right, so we have no more questions here. So let me go through a couple of things here. Best way to lower your chance of contracting COVID, and it's just the same. So, if you're sick, please, please, please stay home. I can't overemphasize that. So it's in China, when they looked as they were starting to get on the downside of this, what they saw is that this usually got brought by somebody who was being brave. I just have to go to work. I just have to do my job, even though they were sick. And then they exposed a lot of coworkers. So if you really are sick, please, please, please stay home. Second is maintain your social distancing, cover your cough. If you're going to be out and cannot maintain social distancing, wear a mask, and then take really good care of yourself. Somebody asked me today, they said, this is really stressful. I'm stressed about my diet and stressed about the work and stressed about all this stuff. And the answer is, this is a time that we're giving you permission not to be stressed about your diet, about your exercise. Just take it easy. Sleep. If you have a few extra calories during this time, you can wear it. You can burn them off later. Just take it easy. So how many of the positive cases reported in our county have recovered? Ashley asks. One has fully recovered, and I was told this afternoon that there are several that are close. In the next few days, I think we'll have more recoveries. So recovery in Oregon means that you're free of all symptoms for 3 days. So that is the most rigorous definition of recovery, and that's why the number of recoveries in Oregon looks a little lower. So what do I think of drive-up church? Nayed asks. I think that's perfectly great. So again, anything you can do where you have social distancing would be fine. I'm old enough to remember the days when we had drive-in theaters, which I thought were just a blast, and I'm really disappointed they're gone. So I could imagine a drive-up theater kind of thing for church would work great. But again, what we're trying to do is we're trying to enforce social distancing. And again, you don't have to be perfect about it, but every little bit we get better will be great. So I saw a post about several hundred negative tests and 12 positive. Is that how many tests were done and how many were negative? So the numbers as of this morning were 12 positive cases, 416 negative cases. There are still some pending, about 30 or so pending cases, but there were 12 positives and 416 negatives. Now, the order that these tests are done is just maddening, because we did a couple of clinics last week. The ones from the 31st, all done. The ones before that, not all done. I don't understand how they get out of order, but what happens is when we send them to Quest, they send them to the lab that has the most availability. So what happens is sometimes these labs get backlogged in doing it. So it's not that the test takes longer, it's that the tests themselves are backlogged. So do we still have a positive in Reedsport? We'll always, in the Reedsport area, we'll always have positive in the Reedsport area. Again, we're not commenting specifically on recoveries in any area. So is it possible to have the virus and not get a fever or cough, but have a sore throat and coughing up phlegm? I wouldn't say anything is impossible. When you look at the cases, the big symptoms are going to be fever, cough, and now we know diarrhea. Actually, coughing up phlegm, a productive cough, is quite uncommon with this, which is really unusual. Because for most illnesses, you cough up phlegm. In this case, coughing up phlegm is not all that common. Some people do have sore throat, so it's possible to do that. And if you're worried, talk to your doctor and we'll do a test. What are the symptoms of COVID-19? Again, the most common symptom is fever. Second most common is cough. Third most common is malaise or diarrhea. The fourth most common is this dyspnea or tightness in the chest. And then also in there is this back pain. And the back pain is kind of unusual. These are people who never complained of back pain before. It says their back just aches. So I read where a tiger came down with the virus. Yeah, I knew this was going to be a question today. Yeah, I saw that too. Now, how in the world do tigers get tested before people? I don't get it. And does that mean that dogs and cats can get it now? And the answer is, I don't know. I think they're going to look at it. We know coronaviruses can be carried by other animals and not really be infected. So, for example, in some of the earlier outbreaks, there were other animals that have it, but really weren't really sick from it. So what do you think the peak time will be, Kim asks. Well, I've always told people that predictions are hard, especially when you have to predict the future. I think the peak is the peak in new cases. So there's a couple of different peaks. It's the peak in hospitalizations, it's the national peak, it's the worldwide peak. If we're talking about the peak in Oregon, which I think is the most appropriate thing to think of, I think the peak is going to happen sometime in the next month. But you remember, what we've been talking about since the beginning is flattening the curve. So if you think of the way this disease was predicted to go if we did nothing, was you'd get a really big peak and then would come down quickly. And the goal and the problem was that if it went up that high, that you'd overwhelm the hospital system at this point, and you wouldn't have enough hospital beds or ICU beds. So the goal was to flatten the peak. And when you flatten the peak, instead of being a really sharp peak, is kind of this plateau-like thing. And I think we may be entering that plateau. We may not actually have a peak like Mount Thielsen kind of peak. We may have a peak more like the coastal range. Yeah, so Diana asked, what do we deal with these large groups of people? Do we call the police? Do we call the distancing police? There are no distancing police, and the cops really don't want to hear about this. Large groups of people are a problem because those large groups of people will pass it inevitably. And so we're really, really trying to do that. I will call any groups of people that are congregating, and I will go ahead and give them a good talking to. But, they don't always listen to me. But I think we have to do this because the problem is these people who say, well, I'm invincible. Well, they may think if they get the disease that they'll be fine, but they may pass it on to me, and I'm older, or my parents, and that would be really deadly. So do you think that some people may have had this earlier than we were informed about? It certainly is possible that some of that junk that was going around in January and February was related to COVID infections, and we just didn't have enough testing or sensitive enough testing to find it. The good news is the antibody test is really quite both sensitive and specific. So when we get that test around, we'll know. So what I'm asking people is that if you think you had it, when these tests become more widely available, talk with your doctor about it, and they can do this antibody test, and then we'll know. And that will be very useful in a couple of ways. One is to get idea of what more mild symptoms would be like. That would also be useful to know how many people are immune. Because if we do have lots of people who are immune to this, that's a good news, because that means the second time it comes through or the third time it comes through, fewer and fewer people will get it. So can you get it more than once? And we do not know. So there are some people in Asia, especially in Korea, who are looking like they may be getting it more than once. Although we don't know of anybody, we don't know if they're just slow to get over it the first time or whether they got it and they got it again. And I don't know the answer to that one. There's another disease out there, a thing called RSV, which gives you this kind of deal where the kids get it, they get really sick, and then they get better, and then a week or two later they get sick again. And we're not sure if that's a recurrent RSV infection or they just never really got over it the first time. Okay, that was the same question. Could the virus mutate? And the answer is yes, the virus could, and probably almost certainly has mutated. So what happens in viruses is that viruses are always mutating. Some mutate really fast like HIV. Some mutate pretty fast like influenza. Some mutate very slowly like measles. And some mutate very slowly like chickenpox. And we know this because 100-year-old people have shingles. The virus that comes out is the same virus they got 100 years ago. And so you can check on that, and the chickenpox virus doesn't mutate very much. But RNA viruses do mutate quickly, and that's why new pandemics come out. So what we think is bats fly around with this, and bats fly around, so they move around, and bats tend to poop anywhere they want, and then other animals eat the poop, and it's gross. But what happens is this is how these things move around. Most mutations are nonsense mutations, and they make the virus less strong, and they go away. But there are some mutations that make it stronger. So there was this study called the Seattle Flu Study that looked at this virus when it came into the U.S. and it did mutate a little bit. Now, not a lot, just a little bit. There was an interesting thing that was in the Times last week that looked at the entire code for this, and it's, the code is ACTG. It repeated in many ways, and there are like pages of this different thing. And so there are slight little mutations in there that don't really change the virus, but the virus mutation helps us to know when it was introduced and where it spread. So yes, the virus does mutate. Will it mutate to the point where it's not where it sort of goes away? Probably not. That's usually not how viruses work, but this is a new one, so I don't really know. So Kayla asked, do we have a lot of test kits left or still just a few in Douglas County? So the answer is we're always getting more. We now have the stuff that you put this in used to have to be viral transport media, which was in very short supply. Now it can be salt water. And thanks to our friends at Northwest Compounding, they've made some vials. But I can tell you it took 100 phone calls to get this done. Not because of their reticence, but because of the FDA's reticence. So we have a few more test kits left. I think we have enough to do our testing on Tuesday and Friday. We're playing this by ear afterwards. So can I explain the incubation period, Nancy asked? So incubation period is the time between you're exposed and the time you develop symptoms. And all different viruses have different incubation periods. So flu virus is pretty much 2 or 3 days. So you get exposed on Sunday, and you get it on Tuesday or Wednesday. Norovirus, which is that cruise ship diarrhea thing, has an incubation period of almost exactly 30 hours. And so when somebody gets this, a kid gets this, the mom says, well, am I going to get it? And they say, well, when did they start? And they said they started at 8 o'clock this morning. 30 hours, so tomorrow at 2 p.m. you're going to start vomiting. And he says, well, how'd you know that? And the answer is, I do know. And they do. And they call back and say, you were genius to predict that. Because with norovirus, it is 30 hours. This one is more variable. This one is 2 to 12 days. Although as we're seeing more and more cases, it really is peaking at 5 or 6 days. So again, you get exposed on, so let's say you get exposed on a Sunday, Monday, Tuesday, Wednesday, Thursday, Friday or Saturday is when you'd expect to get it. And during that incubation period, your body is making more virus, but you're not really having symptoms until the incubation period is over, and by then you have the symptoms. Yeah, so what precautions can I take for going to a medically urgent eye appointment? Gabriel asked. I think this is a great question. So if you wear a mask and the provider wears a mask, that is pretty darn good. So in that case, if I was going to go to the eye doctor, I would certainly wear a mask, and I would ask the provider to wear a mask. And again, if you watch that Mythbusters video, I can tell you almost no spray went through that mask. So that would prevent your spray from infecting the doctor and their spray from infecting you. So I would have you both wear masks. So Penny asked, what do you recommend for disinfectants? It turns out that this is kind of a wimpy virus. So soap and water works. A dilute bleach solution works. Most of the hand wipes work, and the hand sanitizer all work great as disinfected. So some germs are really hard to kill. So there's this thing called C. diff, which is really hard to get rid of, and norovirus, which is really hard to get rid of. This one, relatively easy. So do the OHA hospital vented numbers? So Justin, if you could write in that question again, didn't really get it. So Justin, if you could do that again. So President today said that everyone has enough tests. I wish she'd put me on the list. I mean, really. So the story is there's so many barriers to testing. There's so many barriers to testing. And so having enough tests theoretically is very different from having enough tests for people who need them. So in Douglas County, we've not denied anybody any tests, but that is not the story in most of the rest of the county and most of the rest of the country. So I'd ask him to give you a call. So if you have an in with the president, ask him to give me a call, and we'll have a frank chat about that, because I don't think that's right. So I just heard there's 86 test kits and 49 thingies of saline, my daughter said. So we have enough for two more things. Oh, are the OHA numbers current hospitalized or ever hospitalized?
I think they're currently hospitalized.
they're currently hospitalized rather than ever hospitalized. So we give both the ever, because it's confusing, we give the ever hospitalized, which is 5, and currently hospitalized, which is 2. Actually, that's about the numbers you'd expect, right? So you'd expect about 20 to 40% of the people to require hospitalization at any one time. All right, we've got one more coming here. So again, Facebook video about the mythbusters thing. My dear daughter did a great job. So what do you think of the tiger testing positive? Well, we talked on this a little bit before. First of all, why are we testing tigers before we're testing people? Really, that's one thing. And we do know that animals do carry coronavirus, and sometimes they carry coronavirus without getting sick. That is the reason that the early the early CDC guidance suggested that if you were sick, you stayed away from your animals, because we weren't sure if the animals could carry it. So it's possible they carry it, but in the whole scheme of things, pets are so much more important to us than I think that tiny risk that they would test positive. Yeah, we've seen some terrible things about people leaving animals at a shelter or neglecting their animals because of the fear that the animals might carry this. Please don't do that during the stressful time. What could be better than a pet? So, are those with hepatitis C at increased risk, and should they take extra precautions? Belinda asks. We don't know, actually. That was not one of the specifically cited things in the Chinese literature. Now, we do know that people who get this do get liver dysfunction. So if you already have some liver dysfunction and then get this, presumably it's worse for you. So really the issue with hepatitis C is whether you have any liver dysfunction. So will we ever get to a point where we're testing people who do not have a PCP? So we've heard from Evergreen that they'll see people who don't have a PCP, and if they think you need testing, they'll go ahead and send you over to the clinic. So if you do have symptoms suggestive of this and don't have a PCP, the people at Evergreen said they would see you. Now, one of the things when this is all over, we're past this is sort of all over, this is in the rearview mirror, there are a couple of things that I'd recommend that people do. One is get your flu shot, because we're all dying for a coronavirus vaccine, and there isn't one. There is a flu vaccine, so please get it. Second thing is get a PCP, because if you have a doc and you got a question, you can call them up and say, hey, what do you think about this or that or the next thing? And so getting a PCP is going to be one of the great things. And we know that next year we're going to start the residency program at Aviva, and that residency program at Aviva will have 8 new doctors in the community who will have openings. And it would be so great to work with one of these young resident doctors. My doctor just recently retired, so I'm waiting until July, and I'm going to use one of them as my PCP. So Clover asks, what will allow us to return to some normalcy? So there's a group in the state that's looking at that, and I've been asked to be on that group, and I think there's 4 things that we need. First is we need adequate, rapid testing. So you can't know who has this unless you can do testing and get the results back within minutes or at latest the next day. So somebody comes into my office and says, I'm coughing and sneezing and whatever. Do I have coronavirus? And I said, I don't know. And so if they come into my office and say, I think I have strep throat, I can do their strep test. And in 6 minutes, I can say, good news is you don't have strep. Or, ooh, you've got strep, so let's go ahead and keep you at home and we'll see how this goes. With this test, not getting results back, having to do a really difficult nasopharyngeal swab and then wait a week or so for results really doesn't help. So we need to have a lot of easy, reliable, quick testing. The second thing that we need is we're going to need to give a little pause here so that everybody who's down to their last days of PPE get a chance to build it back up. So the feds need to build back up the stockpile, the state needs to build back their stockpile, the hospitals need to build back their stockpile, because if you say, oh, it's, go out and go to games again, and we start having another surge of this, we're going to need enough PPE. The third thing is we need enough people like, if you listened to the radio before, Laura and Kristen, Vanessa, and all these people who can track down the cases. So we have enough in Douglas County. Most of the other counties do not have enough people to track down these cases. So to get this sort of down, we need to have enough people that they can call, do the interviews, track these people down. And so we'll need that. And then we'll need to see a sustained decrease in the number of cases. We are not seeing any of those things yet. So I think it's going to be a while until we can release a lot of restrictions. Now, we may be able to release some restrictions before that. So an interesting article today written by epidemiologist looked at what logical ways that you might do it. And they said, for example, you might open up restaurants, and instead of having all these tables close and people coming with big parties, what you might say is, well, you can go with your spouse. You've already exposed them and they've exposed you. So maybe you could go to a restaurant if the tables were groups that had already been together and were 6 feet apart. That sort of makes a great sense. Or you might be able to open up hairdressers if both the hairdresser and the person who was doing and the person who was getting their haircut both wore masks. I think that would be pretty effective in reducing transmission. And at some point, we're all going to be shaggy and we're all going to need haircuts. So I think you could do that. I don't think it's going to be in the next month or so, but I think over this next month or two, we might be able to have reasonable relaxations. So Dottie asked, do you think we can trust supplies from China? Well, before all this started, we did. I mean, most of our stuff came from China, but in that case, it came from certified factories that were done by reasonable distributors that we had long-standing relationships with. So every office doesn't buy this on Amazon, so they typically go through a distributor. That distributor works with a known factory in China, and then it goes through. And I think in those things, you can definitely trust it. Right now, however, that's totally broken. The distributors don't have any stuff, and the stuff you're dealing with is an unknown place on the interweb. And I don't know about this. What I've said is if you can make a counterfeit Rolex watch, you could certainly make a counterfeit N95 mask. So I think you do need to be careful about all these things, whether they come from China or anywhere else, that there may be some counterfeits out there. What could this be if our patients are testing negative for COVID, Lacey asks. Such a great question. I mean, right? You have all these people who are really pretty sick. What in the world do they have if they don't have COVID? And so the Seattle flu study will tell us at least the story in Seattle, because what they did is they did very sophisticated studies of everybody who was sick and found that many had flu, some had COVID, but then some had other things. There's this weird thing that's out there called metapneumovirus, which actually there's been an outbreak of in Oregon. Usually doesn't cause death, but can cause a lot of respiratory symptoms and sometimes can cause pneumonia. And some of this may be metapneumovirus, and the current tests don't look for that. So if you had a flu shot in September, should I get another one now? Well, flu is pretty much gone. So if you're over 2 years old, which you probably are, one flu shot a year is fine. However, when a new one comes out in September, October, everyone should get it. So how long does a flu test take? So a flu test only takes a few minutes. So flu lives in your anterior nose, so it's a relatively easy throat or nasal swab, 6 or 8 minutes until you get it. We have plenty of flu tests. So yes, you might still do a flu test, but the number of flu diagnoses in Oregon in the last week was extremely low. Do you still need a negative flu test to be tested for COVID? And the answer is no, because the rate of flu is so low. You remember when all this started, it was January and February, when there was a lot of flu going around. So it made sense to look for flu first. Now that flu is pretty much gone, it doesn't make a difference. So during testing, do patients blow their nose prior? So that they have nasal discharge, they should. I will tell you, remarkably, in the ones that I've swabbed, almost nobody has a runny nose, which is weird, right? Because most upper respiratory infections have a prominent runny nose. These people do not seem to. Could those who have symptoms for days before getting tested have a lower viral count causing false negatives? Absolutely. So the amount of virus in your nasopharynx with this is very low. Unlike flu, where it's in the gazillions. That's not really a number, but it was really, really high. In this one, the amount of virus in your nasopharynx is low, and that's why this test shows false negatives. So my son has Hunter syndrome. Is he more vulnerable to the virus? So the answer on all of these things is, so Hunter syndrome is a rare syndrome called a mucopolysaccharidosis. And And so we do not think that with people with underlying conditions are more vulnerable to getting it, but we think that people with underlying conditions are much more likely to get very sick or die from it. So I think in somebody who's got Hunter syndrome, depending on where he is in the illness, it could certainly be an issue. And I'd certainly recommend that you stay home. So Diane asked about using HVAC bags, dangerous to use as a mask filler. We are still looking for guidance from the CDC about what should be in the mask fillers. The only one that we've seen that's approved is interfacing. So interfacing, which is that sort of gauzy stuff, is recommended. HVAC bags have been used, but I haven't gotten the results yet from CDC. You'd think when they recommend that you use homemade masks that they would that week put out like, oh, this is how you should make them, but they haven't gotten there yet. So Heather asks, after this is all over, are you still going to come on and speak to us about the county? I would be happy to, but on the other hand, I'm really hoping to put my media career on hold for a few months, but I don't mind doing this. So if the spread is really trying to be stopped, why haven't people told what towns? So the story is, it is everywhere, Travis. Don't worry, it's everywhere. I will show you the map. It's everywhere. And so don't believe that because it's not in your little part of the world that there are no cases. There are cases everywhere. So what town? So, just go up and down the I-5 freeway. It's in every one of those towns. And I'm pretty sure that it's also in the other places. So knowing exactly where they are, not great. So are homemade masks without a filter just as effective? So the more blocking power you have, the slightly more effective they are. But the more blocking power you have, the far and away more annoying they are to wear. So this mask is just 2 pieces of cotton and is not unreasonable. I wore this or its brother most of the weekend. My wife also made one with fusible interfacing, and it was a little harder to breathe, fogged up a little bit more. It turns out that 2-ply cotton is pretty darn good for protecting what we're trying to protect, which is the spray out. And again, if you look at that video, you'll see even this was just a 2-ply cotton thing that we used. It blocked almost all of the spray. So Nancy asks, how many studies are being performed on COVID in New York and how long before they'll be published? So I read yesterday there are 149 clinical trials going on around the country. Unfortunately, I think probably in New York, they're just working so hard to keep their head above water that they're not having time really to engage people in studies, which is unfortunate because with all of those cases in New York, we could learn so much about what works and what doesn't work. And unfortunately, I don't know when they'll get published. I would hope soon. So some of the Korean studies and some of the Chinese studies are there. There's a European study from Italy, which is coming out. What these are showing is that these are mostly old and sick people who are dying, that there's no one strategy which is remarkably effective. Some suggest chloroquine has a little advantage, some suggest it doesn't, but it's certainly not a wonder drug. So 80 years ago, pneumonia happened, and bacterial pneumonia happened, and people would get it, and old people would, basically, they got it, they died. Penicillin came out, it was like magic. So people who almost all died before you could give them this drug, and they all survived. Bacterial meningitis was a death sentence before, and with this, people revived. It was so obviously it worked. There's nothing that they've looked at so far which is that obvious at work. These things may help a little bit. So the inhaled interferon, the ribavirin, the chloroquine, all those things may help a little bit, but they certainly don't help a lot. So Jennifer asked, is it airborne? And so the story is we think mostly this is droplets. So droplets mean that, you like spray paint, you do that. Airborne means that it stays in the air for a long time in tiny, tiny, tiny little particles floating around. And there are only a couple of germs that do this. Chickenpox, measles, and tuberculosis are the ones that are airborne. And that's where you need to use really good protection. We think this is probably not. These relatively large lipid ones usually are in droplets, usually not airborne. We can't be for sure, and that's why we're asking people when they're around aerosolizing procedures like swabbing somebody's nose, suctioning somebody, or using a nebulizer, that you do use airborne protection, which would be the N95 masks. We think in general, in public, probably not necessary. So Jessica asks, how contagious is this? This is so fascinating, and it's hard to think of something so bad as fascinating, but it is. And what's fascinating about it is that this appears to be differentially contagious. There are some people that get this and don't give it to their mates at home. I mean, you're sharing all this stuff at home, and they don't do it. And then other people who share it with hundreds, and we think one lady in Korea with thousands of people when they were relatively well. So this one is weird in that contagiousness is so hard to figure out. Now, we had a little hint of this because with SARS, which is also coronavirus, there were some weird contagion things. It was one guy was in a hotel and gave it to most of the people on the floor of the hotel, although he never opened his door and they never opened their doors at the same time, we don't think, and yet they all got it. So this coronavirus is really weird in how contagious it is. So it's anywhere from a little contagious to a lot contagious, overall pretty contagious. So I'm reading that it's morphing into different strains. It probably is. If we get a vaccine, will it be like the flu where we could capture the wrong strain? Oh, Kathy, you need to become an epidemiologist. So that is really one of the concerns, is that it would morph and then you would get the wrong vaccine. So the flu vaccine is generally good. Every 5 or 10 years, it's not so good, because the vaccine that they make in the springtime, usually in January, February, around this time of the year, for the flu that's coming in the fall, by the time the flu gets there in the fall, it's morphed enough or mutated enough so that the vaccine doesn't provide good coverage. And that is one of the risks of the vaccine. So one of the risks of the vaccine is it may be great against this one, but 6 months from now when the vaccine is actually produced, it may be less effective. And that is one of the big concerns. So what we're going to need to find out is we're going to need to find out the mutation rate. Remember I said HIV, very fast mutating, flu, pretty fast, measles, very slow. This is somewhere in between. If it's like flu, that could be an issue. If it's more like measles, less of an issue. So please tell us the proper way to use PPE. Well, tomorrow we're going to have a video out there that talks about the proper way to put it on and take it off. And I see Kristen here. She is going to show everybody how to put it on and take it off. And this could be a perfect thing for a YouTube video. So is fever a definite symptom in all cases, Sandra asked? And the answer is no. About 10% of the cases never had fever. Almost all the people felt warm at some point, but about 10% didn't have fever. And that's a problem, right? Because if you say not everybody has cough, we know there are about 15% of people don't have cough, and you don't always have fever, and you don't always have diarrhea, like, how do you know when you have it? And that's one of the difficult parts of this disease. So Patty asked, should the public wear N95 masks? And the answer is no. Those N95 masks need to be saved for people who are working in the ICU, suctioning people, intubating people, doing nebulizing treatments, because they're the ones who could be at risk for this. In general public, since you're protecting people who are from your spray, a regular cloth mask will work fine. Will we all get this eventually, Brooklyn asks. I hope not, because it probably does have a death rate of a few percent. And so all the Americans who could get this, got this, there's a lot of people dying. So I really, really hope not. I will hope that we will get a vaccine and that people will get the vaccine and then have immunity to it. It's really amazing that even in the places where there's a lot of cases, the attack rate, that is the number of people in the population that get it, is very small. So if you think in China, 80,000 people got this, it sounds like a lot, but there's 1 billion people in the country. Similarly, in New York, we're talking about 100,000 people having it, but there's 15 million people in New York. So it's really a tiny percentage of the people that get this, which means that everybody else who hasn't gotten this is still susceptible. This is where the antibody test will help, because we may find that, for example, in New York, that they had, in the end, say 300,000 cases, but then there may be another 3 million people who had it and didn't know it. And that's where the antibody test will be so incredibly helpful. So Nancy asks, will the vaccine be safe when it comes out? I sure hope so. And how do you find out the safety of vaccines? So vaccines go through multi-stage process. The first stage, which is already done for one of the vaccines, is they give it to healthy volunteers. Got to be pretty brave to be that volunteer, but they give it to the volunteers to be sure that there's no side effects. It's usually a relatively small number, and then if it appears to be safe for them, then they do a larger number. If it appears to be safe for them, they do a larger number still. So there have been some vaccines that were not safe way in the past. There have been none in the last 30 years, but that's how you find it out. So you start in a small group, go to a bigger group, and then go to a larger group still. Yeah, so Justin wants to know, have any of the hardworking people at Mercy become ill from exposure? There are people at Mercy and everywhere that are ill, right? So anytime you work in a clinic around people who are coughing and sneezing at you, you get sick. We don't think we've had any positive healthcare workers at Mercy, but I don't know. So do you see this slowing down? Sonny asked, absolutely. And this will slow down. And again, remember we talked about the big peak or the slow, the low mountain. I think we're going to have a low mountain. I think what we're going to see is we're going to see, in Oregon at least for a while, 50 to 150 cases a day, and then it's likely to slow down. The problem is going to be at some point we're going to have to relax restrictions. People can't go forever without going shopping. They can't go forever without getting their hair cut. They can't go forever with some of the restrictions we have here. And so when we relax the restrictions, we might start to see more cases. So it's going to be really difficult to know how and when to release the restrictions. So how long do you wait to get a test if you're symptomatic? Not very long. You know, if you're sick for 2 or 3 days, you should get a test. You know, the problem is with one day is we all have the occasional day where we wake up coughing a little bit because we ate too much pizza last night and had a little reflux, or the pollen is out. So you never quite know on the first day. But if you are symptomatic, especially with fever, cough, or shortness of breath, by the second or third day, you should get tested. So will a Z-Pak or amoxicillin help with whatever this other thing that has been going on for months? We don't really know. So lung diseases are the most frustrating to treat, right? So if somebody's got meningitis, I do a spinal tap. We find out exactly what the germ is and exactly what the right antibiotic is. If you've got a urinary tract infection, we have you pee in a cup. We look under the thing. We can see the germ. It's relatively big. And then we find out the very best antibiotic for it. So I feel like such a scientist when I treat meningitis or when I treat urinary tract infection. With the lung stuff, the only way to know would be to do a bronchoscopy. That's put this tube down your throat and suction out the stuff from the bottom of your lungs. We almost never do that. So we're always guessing at these lung things. And with guessing at the lung things, we have to guess. Z-Pak, not unreasonable guess. It covers most of the things that cause a bacterial bronchitis. But most of the things that cause bronchitis are viruses that we can't ever find. So is it reasonable to try? Maybe, maybe not. It's so unlikely to be hurtful, though. So you should talk to your doc. So does ibuprofen make this thing worse? And again, I knew I was going to get that question today, so I looked it up again last night. And there is varied opinion on this. There's a story about ibuprofen and non-steroidal anti-inflammatory drugs changing the ACE2 receptor site. I don't know if I really believe it, but so that was theoretically why ibuprofen might make it worse. And then there was a very small series that suggested this could make it worse. I think in the end, the consensus is it probably doesn't make a difference. So are we still thinking we could double every 10 days? So our model suggested we were going to double every 4 days until we had 10 days of restrictions, then double every 5 days, and then double every 10 days, stay stable for 10 days, and then start decreasing after that. So that was the model that we put out. So there's 11 different models that we're looking at now. Again, if you think of the weather forecasters, they have the National Weather Service model, the European model, and they track where your hurricane is going to go. And as you get out further, it gets wider and wider. And that's what we're seeing with this. So when we look at our 11 different models, there are a lot of different models. The model I predicted was about in the middle, but it turns out that Oregon's cases have been much slower at coming and much lower than anybody would have predicted. So I did one today that looked at the different states in the United States after they reached 10 cases per 100,000 population. So when you look at Oregon, when we reached 10 cases per 100,000 population, we've been kind of flat, where New York and California and Washington, Louisiana all shot up. So our model, which was a reasonable model at the time, actually overpredicted, I think has overpredicted the number of cases. And this is one time where I'm so happy to be wrong. So while we're waiting here, hotline is still going, 541-464-6550, 541-464-6550. And the question is, how do asymptomatic people spread it? We really don't know. I mean, these are asymptomatic people who are not coughing and sneezing, so they're not having lots of respiratory droplets. They must be putting out a phenomenal amount of virus, so that people who are, even passing them on the street or in a meeting can do it. And this is one of the mysteries of this virus that hopefully someday we'll figure out. But right now we don't know. So again, if you look at the super spreader phenomena, that is a weird phenomena associated only with coronaviruses. You don't really see super spreaders in other kinds of illness. Now, norovirus, you'll sometimes see super spreaders by people don't wash their hands. That's pretty obvious. But we don't really understand why that happens. There are a couple of other diseases where that happened. Older people remember Typhoid Mary was somebody who was a typhoid carrier and spread typhoid, was a bacterial disease to lots of people. But we don't actually know how asymptomatic people are spreading it as they do. It actually seems to be the people who are spreading it the most seem to be pre-symptomatic people. Now, of course, you wouldn't know about asymptomatic people because they're asymptomatic, but there have been a number of really good cases where people who later did get the illness did spread it. So could a CPAP help, especially with oxygen, if no ventilator is available? Wendy asked a great question. And we think the answer is yes. It's called non-invasive ventilation. So invasive ventilation is a tube and a ventilator. But before that, CPAP or BiPAP could certainly help if no ventilator was available. Some places have suggested that. I haven't seen it much on the news, but actually a colleague of mine from Central Oregon and I put together a little study about this, or a little group of studies about this, and has suggested that it would certainly be an option if you ran out of ventilators. So Laurel asks, is losing your sense of smell and taste a symptom in most cases? Certainly not in most cases, but certainly in many cases people have reported that. So you'll remember a few weeks ago we did a study where we asked people to smell cotton balls soaked in orange and cotton balls smoked in Listerine to see if they could smell that. And it turned out that all the people who couldn't smell didn't have COVID, and all the people who had COVID could smell. So at least in our small series, it didn't work. I chatted with some world experts on this, and they said, well, that's, soaking a cotton ball in orange essence and Listerine is not the most scientific way to do it. We have much more scientific ways to do it. Well, those people who are really scientific haven't reported yet, so I don't know. Okay, we have one more question here. We have no more questions here. So a couple of things. Again, 12 positive cases, 416 negative results, which is great. The hotline, 464-6550, 7 days a week, 8 a.m. to 7:30 p.m. Next testing clinic tomorrow at 12:30 at the fairgrounds. And watch the Mythbusters on YouTube, and I think we got it. All right, again, this is Dr. Bob Dannenhoffer. Thank you again for joining us. We'll see you again on Friday.